Good morning, everybody. Good morning. Good morning. I'm so glad you're here. Welcome to the Global Health panel session. We have some wonderful presenters for you today, and we're just going to jump on in and get started. I ask that as they are speaking, when you have questions, to write them down because we're saving our Q&A for the end of the session, okay? Awesome. So first, we have Christiana Obeng. She's from the College of Medicine. She'll be talking about sustainability of WASH, infrastructure in Lesotho, observations of attitudes of the Lesotho and their impact on project longevity. You ready? Come on up.
All right, good morning, everyone. And as said before, my name is Christiana Obeng. I am a second-year medical student at Drexel. And today I'm going to be talking about the sustainability of WASH infrastructure in Lesotho and my observations of the attitudes of the Basotho and the impact of those attitudes on project longevity. So the problem is that as of 2015, the United Nations said that 1 out of 4 people worldwide don't have access to clean drinking water, and 2 out of 5 people worldwide also don't have access to proper hand washing facilities, and about 673 million people worldwide are still practicing open defecation. So organizations like World Vision and its sister organizations rose to the call and went out to erect and build facilities, hand washing facilities, latrines, tip taps, and to be able to solve this problem. And this is just a little schematic of what World Vision is doing in Lesotho. So you can see there that they're building hundreds of wells and sanitation facilities, thousands of hand washing facilities, and they call it tip taps. And also they set up health committees in these areas to be able to help and maintain these facilities. And this past summer in 2019, I had the opportunity through Dornsife School of Public Health to go to Lesotho for 6 weeks. And my job there was to assess the impact of these facilities on the health burden in Berea district in Lesotho. But while we were going on the field visits, there was this recurrent issue of maintaining these facilities that kept coming up through the meetings that I was going to, through conversations that I was having with the people in the neighborhood, with the World Vision staff. So the first one, and the first time I ever saw this issue was at a town hall meeting at Hat Sanekane, which is a village there, and it was pretty much a congregation of about 5 other villages, and the health committee in charge of it was kind of bringing up the issues that they were seeing. And the next few slides are just going to be talking about some of these issues. And some of the issues that the health committee leader was talking about was that even though these latrines are being built and a lot of money and effort are put into it, she realized that while she was doing the rounds, some of the doors on the latrines were being taken off and they were used as materials to patch their roofs. There was poor upkeep of the facilities, so people would rather go back to open defecation than to use an unsanitary latrine. Also, I talked with the headmistress of the nearby secondary school, and she said that some of the students would come by on weekends and vandalize the latrines. So even though they're being built, they're not lasting long. And also, the community members were storing firewood in the latrines. So again, instead of using that latrine, they would go back to open defecation. And there was little accountability between the community members to keep these facilities because they were more like communal latrines. So there was little responsibility individually to keep them up. And the last was that the hygienic practices that had been taught to the community members, the health committee leader was saying that she wasn't seeing that being practiced in their homes. And these are just a few pictures that I took. I couldn't take a lot of pictures because I didn't have permission to, but the picture on the left side is just what you see with most of the taps there. So even though they have built it, you go back 3-5 years later, and some of the knobs are missing. So you could see it was abandoned by the time we got there, and they weren't really used. And the top right is what you'd see in most of the taps that are being used. This is kind of like the sanitary conditions around there, and it's also reflective of how the latrines were being kept. And the bottom right is just a picture from the town hall meeting that I was able to take. And I went to a nearby HIV clinic to talk with the nurse in relation to my actual project, and I brought up these issues that I saw at the meeting, and she kind of agreed, echoed the same things, that even though they also teach their patients at the hospital hygienic practices, and she said that she saw little improvement in the practices, she saw little improvement in how the patients were practicing the things that they had been taught at the hospital. And she said that some of the reasons why people weren't keeping up the facilities was because if you ask them, which facilities are these in your neighborhood, they would tag that latrine as, oh, that's the latrine from World Vision, or that's the water tank from Tolong, or that's the tip tap from the government. So kind of labeling it according to the sponsors, in their minds, they're thinking the sponsors are gonna come back and keep them up. So it relieves them of any responsibility to take care of these facilities, and that was her opinion of why people are not really taking care of it. And I came back to the office at World Vision and I said, hey, you're doing a great job and you're putting a lot of money and effort to build these facilities, and that's what you're supposed to do. But when you actually go to the field, this is what I'm seeing, this is what I'm hearing. And is it something you agree with, and what's the solution to this? And he also agreed to that people are labeling these facilities and thinking that World Vision is going to come back and keep them up. But World Vision is not going to come back and drink from that tap or use that latrine. So it's the responsibility of the community to keep them up. Other issues that he brought up, my director, my World Vision director, he said that the way World Vision trains the community is that they have a health committee, and they train them because they're more health literate, and the health committee will disseminate the information to the community. And he said that the information that they give the health committee, they realize that when they call back to see if they've had that second step meeting, that most of the time they haven't had it. And the other thing was that World Vision was not having frequent check-ins with the health committee to make sure that they are having that second step meeting. And then the last thing was that the community members were not following up and going around the community to realize or to assess the health of the facilities as often as they should. And the last slide, the last observation I'm going to talk about, we were driving by this high school, what they call a secondary school there, and I saw that the facilities was in pristine shape, and I wanted to talk to whoever was in charge that, how is it that you're doing so well? And the other, schools are kind of like slacking, for lack of better words, and she said that most of it is the students that are doing it. They set up their own wash club. After school, they would stay and teach each other practices, and also that interest had extended into nutrition, so they had set up their own nutrition club, and they had their own school garden, and so it was a lot of like self-garnered interest on that part, and that was why they were able to do so well. So in summary, like I said earlier, World Vision and its sister organizations have risen to the call that UN reported, risen to the need that was reported in 2015, that there is a need out there to be able to curb open defecation and provide access to clean water. But as I saw in Lesotho last summer, that there is poor upkeep of these facilities. And so the way forward is to really, really push for what we call the community-led total sanitation. And that's a way for World Vision and all these organizations to garner interest at the community level instead of just going and building facilities, sit down with the community, and throughout the process of building and planning, involve the community, and you can get that improvement and buy-in and maintenance of these facilities. So that's all I have, and I'll thank you for listening.
Awesome, awesome job. All right, so we're just gonna keep going and we're just gonna go in order. So next we have Catherine Boyd from the College of Medicine. She'll be speaking about a barrier analysis evaluating the obstacles and perceptions regarding hand washing at critical times, and hopefully I'm saying this correctly, Shangwe, Zambia.
Hello, everyone. Like she said, my name is Catherine Boyd, and This summer, I had the opportunity to do a Dornsife Global Development Project alongside Maxine Davis, who you'll be meeting shortly, in Chongwe, Zambia, so you're very close. And we sought to understand and address some of the barriers to hand washing at critical times in rural Zambia. So first of all, I'll just start out with a sad statistic. As of 2016, UNICEF estimated that diarrheal diseases, as one of the leading causes of death in children under 5, was responsible for about 8% of deaths of children in Zambia under 5. And this is something that, of course, is linked to the sanitation, hygiene practices of the communities there. And this brings me to the organization that we worked with. Like Christiana, I was also working with a World Vision Water, Sanitation, and Hygiene, or WASH group, and they've really focused these past 30 years they've been in Zambia on strengthening community capacity to do appropriate hygiene. So this is everything from training community hygiene promoters to drilling boreholes, which provide a clean water source, and educating communities on the critical hand washing times. And these are 5 officially recognized times where hand washing is considered critical to prevent the spread of disease. And that is, I mean, these are something that we have kind of in our everyday life, but just to point them out, is after using the toilet, before eating, or before cooking or preparing food, before feeding a child, and after cleaning up a diaper. So these are all something to keep in mind as we move forward. As far as the state of hand washing compliance in our specific district we worked in, Chongwe, which is an area you can see on the map here. It's about an hour outside of the capital, Lusaka. It is a rural area, though. And here they have found that though World Vision has been established and has invested lots of money, lots of community building in the area, there is still low compliance with hand washing. And this is known by both community health workers that are out in the community saying that people aren't keeping up with the routines they should, and also, as you see, household water has tested positive for E. coli contamination, and this is water that's been taken from a clean tested source borehole. So there's some breakdown in hygiene practices between getting the water and using it at home. So this is definitely something that we were interested in understanding more, why there wasn't this compliance, why people weren't adhering. And us, along with our World Vision staff partners, asked the questions, what are the barriers to hand washing with soap at the critical times? And furthermore, what interventions can address the root of hand washing noncompliance? So we chose to do a barrier analysis as it's widely used in behavior change projects. And it allows rapid identification of behavioral determinants, and it has the end goal of developing effective behavior change strategies that specifically addressed one target group. So in this case, we wanted to look at mothers and caregivers of children under 5, and our goal behavior for this was that they would wash their hands every day with water and soap at 3 or more of the critical times, as you can see here. So to begin with, we created a survey that asked questions that would determine what things were pushing mothers or caregivers towards the behavior or away from the behavior. So an example of a question we had on our survey was, who are the people that disapprove of you doing this behavior? Or what are the advantages of you doing this behavior at the 3 or more critical times during the day? Just to get an idea of what was inspiring or motivating them to or not do the behavior. Then we trained local hygiene promoters to conduct the survey. We interviewed 90 participants, and we evaluated the odds ratio and relative risk for each of the determinants that we asked questions about before bringing it all together with a focus group of 21 women and hygiene promoters from the community. Okay, so just a little more information on what our participants looked like. So we had 2 categories. We had 45 doers and 45 non-doers. And doers were those that could affirm that they washed their hands at least 3 times a day at the critical times. And this was also substantiated by their home environment. So they had a tippy tap, which Christiana mentioned is kind of a basic hand washing station. Their tippy tap looked used. They had soap present. It made sense, and they were able to reenact the behavior when asked. And our non-doers were those that did not meet the criteria. Either they claimed not to do it, or they were unable to reenact the behavior or show any sort of evidence that they were washing their hands regularly. And this is just a table of some descriptive characteristics. We wanted to get a better idea of the women that we were working with. So, All right. And as far as the places we saw the most significant difference, this was in the perceived difficulty of remembering to wash hands at critical times, and then the perceived access to hand washing materials. And as you can see in chart 1, doers were 7 times more likely than non-doers to report that it was not difficult to remember to wash their hands with soap. And then in chart 2, we see that non-doers were 4 times more likely than doers to report that it was very difficult to access hand washing materials. More results that we found, though not statistically significant, we were very concerned about the fact that doers were 3 times more likely than non-doers to report that hand washing at critical times prevents diarrheal disease. So there was a misconception here that diarrheal disease and hand washing were not related and that one could not affect the other. So because 16% of our non-doers did not fail to see the efficacy of washing their hands, we wanted to definitely incorporate that into our barrier analysis moving forward and talk about it with our focus group, which leads us to taking our results back to the community. So this was the focus group that we had with 21 women and hygiene promoters from the community, and this was a mix of doers and non-doers. And we discussed our barrier analysis results, and we did a lot of brainstorming about activities that would directly address effectively each of the areas where we saw a difference between our doers and our non-doers. And we came up with a lot of different ideas, a lot of different activities, but the one that seemed to be the most promising was organizing local drama groups to communicate key WASH messages. And here you can see Maxine and I with our focus group in Chongwei. And these are just some of the key health messages within the drama group performances. I'm not going to read them out. These are just things that we believed focused on the things that were the biggest discrepancies between our groups and what would promote the behavior effectively according to the conversations we had in our focus group. Lastly, the exciting part of implementation, there were 6 drama performances with key hand washing messages that have taken place in Chongwei, Zambia as of September 2019. And though we haven't gotten results on how this directly has affected the hand washing behavior in the area yet, it does display a desire for more culturally specific and community-oriented engagement in altering behaviors such as hand washing. Thank you.
Okay, next up we have Maxine Davis, also from the Dornsife School of Public Health. She'll be talking about WASH conditions assessment in healthcare facilities in rural Zambia.
Good morning. Can you all hear me? Yeah? Okay. Good morning, everyone. Like she said, my name is Maxine Davis, and I was in Chongwei, Zambia, the summer of 2019. While I was there, I was able to work on the project with Catherine, as well as take a deep dive into rural health clinics and looking at their WASH capacities. So, Emory University established a new assessment tool in order to understand how WASH was being assessed in health centers. And so it looks at 5 different domains, including the water supply, sanitation facilities, hand hygiene facilities, environmental cleaning practices, and waste management. So there are 7 main World Vision rural health clinics in Chongwei. And so I was able to interview with either like the head nurse or the director of the clinic in Zambia in order to gather this information. So here you'll just see some of the descriptive statistics about like where they're getting their water source from. So most of them are a pipe supply from another facility versus using a borehole. And then so just kind of like giving you a bit more information about each of the clinics. But I really want to dive deeper into exactly how they scored on each of their areas. And so this graph here will show you each of the 7 clinics and where they ranked for each of the 5 domains. So sanitation was relatively the same across all 7. However, hand hygiene was pretty low, and it's something that I will dive a bit deeper into because one of the things I was assessing for was approximation to, like, in an actual room that they were seeing patients, and approximation to a toilet facility. And so oftentimes there was not an easy water source, or there was not soap. And that was like a major concern, and docked points from that. The waste management was kind of everywhere, as you can see on this slide. And so that was looking at how they were disposing of sharp waste, biomedical waste, placentas, anything like that. And there were very strict requirements as to what that would look like. And depending on the clinic, it kind of really depended on what that looked like for each clinic. Most of the clinics were very environmentally clean, and that was really just like whether or not there was trash present on the grounds, and if the rooms inside of the clinics were clean or not. So this here is showing you the total score comparing each of the different clinics, and the chart below the traffic light is kind of showing you what, like, a basic service, limited service, and no service. And it's supposed to rank the clinics. And so it's like a really good assessment tool if you're in an organization that has a lot of clinics, and you can see what's going well and what's not going well. So that way you have the opportunity to make improvements and to congratulate on the things that they are doing very successful with. So 3 of the clinics had a 2.5 score, which is limited service, but it's actually pretty good. I will say that the Lawimba Clinic would have received a much higher score, but upon interviewing with them, they had recently just had their solar panels stolen. And so because of that, it caused a lot of their scores to decrease, because that impacted their main water source and their electricity source, and they did not have enough water storage in order to increase those scores. So that probably would have been a 3.0, or at least closer in the green area, if that did not happen a week before I interviewed with them. And so the World Vision head office had done the same evaluation in 2016 for a lot more clinics across the country, and I was able to have access to that data, and I used it in order to compare where the clinics were in 2016 to how they improved in 2019. So with the 4 clinics that I had data for, 2 of them had increased the most by 0.3 points. And all of them total had increased overall. But that was like the biggest improvement over the 3 years. Just so you can see it for a second. And so once I was finished gathering the results, I compiled this 1-page report to be given to each of the clinics. And it just established what the benefits were WASH, what the benefits of WASH are in a healthcare facility, what the WASH conditions assessment is used for, so exactly like reminding them why I had come, why I was there and interviewing them in the first place, and then I broke down their score for them, telling them their total score and breaking down each of the 5 domains as to what their score was. And I provided areas of improvement and areas for strength. So that way that World Vision, the AP office in Chongwei, and the clinic themselves knew what they could do in order to maintain their number and what they could do in order to improve it. And so there were 2 really big things that I had gained from this, from doing this project. One is finding sustainable access to soap. That was the biggest thing that was bringing numbers down, and also to provide ongoing training to healthcare facility staff on WASH and healthcare. That was a consistent question about whether or not staff, like other staff and like head staff, were receiving training within the last 12 months or upon starting at a new clinic, and most people said no. And then I asked a follow-up question of whether or not they wanted training, and the answer was always yes. But there is no ongoing training for WASH and healthcare facilities to learn how to clean rooms, how to like maintain other WASH things, how to properly separate waste, and different things like that, and even soap production. So thank you all for listening, and I look forward to your questions later.
Awesome. Next, we'll have Brianna Guillory from the Dornsife School of Public Health speaking about a multi-level analysis of early childhood nutrition and WASH practices in Lesotho.
Good morning. Like she said, my name is Brianna Guillory, and I had the opportunity to spend my summer in Lesotho looking at challenges to integrating WASH into nutrition clubs in Lesotho. So WASH and nutrition. Diarrhea is the second leading cause of death in children under 5 globally. And roughly 88% of those deaths can be attributed to diarrheal diseases, specifically having 5 or more within the first 2 years of life. Coincidentally, a lot of those can be prevented from water sanitation and hygiene. Village health workers can also be used to decrease the rates of diarrhea, underweight prevalence, and child mortality through household education. So like I said, I was in Lesotho. So in the map you see, Lesotho is the country engulfed by South Africa. The green box is Mohale's-Hoek, so there's 10 districts, and Mohale's-Hoek was the district that I was located in, and the green star is the capital of Mohale's-Hoek, which I was based at. So to look at Lesotho in context, Lesotho has a really high exclusive breastfeeding rate at 67% compared to the world exclusive breastfeeding rate at 41%. And exclusive breastfeeding is exclusively breastfeeding for the first 6 months of life. Alternatively, Lesotho has a relatively high stunting rate of 33%, where the world stunting rate is 21.9%. So to me, that suggested that there might be a difference between children in Lesotho are well nourished for the first 6 months of life, but that gap between 6 months to 2 years, there might be a disconnect in the nutrition that they're being provided. So if we look at Mohale's-Hoek in context relative to the other 10 districts, they have relatively low child immunization rates, a relatively high percentage of underweight children, underweight births, relatively high home deliveries, and as well as a relatively high HIV rate. So what are nutrition clubs? Nutrition clubs are spaces where existing mothers and caregivers come together and exchange ideas about the information to improve children's nutrition. And that is strongly influenced by village health workers and the curriculum that they're taught by. But before I really wanted to dive and speak with village health workers in the curriculum, I wanted to get a sense about what nutrition clubs were and what were the benefits from nutrition clubs. So to do so, I had the opportunity to do a focus group with a group of mothers. There was about 14 women. And from there, from speaking with them, I got the sense that it's a really strong support group for encouraging breastfeeding, for improving child nutrition. There's a village health worker that will usually come and teach them ways to make their local meals more nutritious through adding peanut butter or other local ingredients to up the nutrition. And it's also a space where they learn proper sanitation of the child, so thinking about hand washing before and after, changing a diaper, or even just wash your hands prior to feeding the child. So then when we want to think about the curriculum and where village health workers were retaining this information, they were trained based on 2 curriculums. One was the Ministry of Health Infant and Young Child Feeding Participants Manual, which was created in 2013, and World Vision's Timed and Targeted Counseling, also known as TTC, which was developed in 2014. Through reading both curriculums, I pulled out key things and key messages that were very important in both curriculums. For the Ministry of Health curriculum, why, how, and when to breastfeed, child feeding when dealing with HIV, complementary feeding, which happens after the first 6 months of life, and nutritional gaps and how to fill those gaps were very heavily detailed in that curriculum. Alternatively, in the World Vision's timed and targeted counseling, they focus more specifically on diet and nutrition, maternal health services, hand washing, and immunization. So as we can see, both curriculums offer a vast difference of information, but there does not seem to be a lot of information about WASH specifically and nutrition. I then had the opportunity to speak with village health workers. And most of their challenges when dealing with women were that it was hard to find women, so because a lot of people would be hiding their pregnancies or their households would be hiding their pregnancies, so it was hard to get in contact with them to encourage them to go into ANC and PNC visits. They were fearful of getting tested for HIV, or if they were HIV positive, they were not taking their antivirals correctly, which could be a challenge when it comes to giving birth to a child and passing it on to the child. Additionally, mothers were also not taking their kids for growth monitoring and immunizations. Outside of dealing with mothers, the village health workers have the challenge of not necessarily always being paid because of the pay system, which was definitely more of a governmental process. So key takeaways from talking to village health workers were that there were innovative ways for the village to contribute. So some villages would say that all women would have to bring a dish or have to contribute 10 to 15 malutis, which is their currency, to bring to a pot to essentially collectively contribute to the services that were being offered. Additionally, village health workers are the sole driving force of nutrition clubs, and there's not a good way of tracking nutrition clubs. When I arrived in June, there was only 2 nutrition clubs in my district, and by the time I left, there were 8. So there's a big range of when nutrition clubs are happening and when they're not happening, but also to relaying that information for tracking purposes. Additionally, nutrition clubs were always beneficial for the women who attended them, but not so beneficial for those who weren't attending them. All women in the village were not participating in nutrition clubs, so that also could be a space for encouraging more women to benefit from the services offered for nutrition clubs. So my key takeaways from my experience this summer were nutrition clubs matter. They're places and spaces where women can come together, be a support system, and kind of have these conversations about the best ways they see fit and has also go through trial and error collectively rather than as an individual. Additionally, the curriculums currently do not incorporate enough wash aside from hand washing and hygiene of the child. So more thinking about sanitation of the household, thinking about instead of just saying the nutrition and the hygiene of the child, but rather the nutrition and hygiene of the household which the child is living in. Additionally, there needs to be a shift of power from village health workers to community women to sustain nutrition clubs and to enable tracking. So something as simple as electing a mother or a community woman to also work with the village health worker to sustain them would be beneficial. And increasing the amount of WASH messaging in both curriculums, which I just mentioned, and then as well as doing more household visits to observe the WASH practices that are being used, just because we know sometimes we can say we do things, but also in reality, how often are these things being practiced and are they being practiced correctly? And thank you.
All right, so far the 2 folks who are graduating in 2 weeks were the 2 people under 7 minutes. Good job. All right, and I just lost my email, 1 second. Okay, and last but not least, we have Matthew Wabwiri talking about the impact of human waste on diarrheal disease among children under 5 in Malawi.
Hello, my name is Matthew Obere, and together with my colleague Sebastian Trott, who is not available today, we are looking at the impact of improper human waste disposal on child mortality, and we referenced this from the work we did over the summer in Malawi. Fairly frequently, when waste is spoken about, among the first thoughts that come to people's minds are, where's the nearest trash can, or am I recycling? Yeah. But rarely do we ever think about human waste, or do we not acknowledge our privilege not to think about human waste? Well, that's until we walk down the subway and you have an acrid smell as you try to walk down to your train. But today, human waste is a very big issue that faces this world that's not spoken about. And many non-governmental organizations have made strides in order to address these issues, and World Vision's WASH program has been a major player in addressing these issues, as you'll see. Just to give you a brief background about the status quo in the world today, about 2.4 billion people lack access to toilets or latrines, and of these, 946 million defecate in the open. To put this into perspective, 946 million is 3 times the population of the entire US. So that's just to give you an idea of what is happening in the world today. And each day, nearly 1,000 children died due to preventable water, sanitation, and sanitation-related diarrhea diseases. The Sustainable Development Goals that were created, number 6 aims at achieving access to adequate and equitable sanitation and hygiene for all and ending open defecation by 2030. It's 2020 right now. That means we only have 10 years till we can achieve adequate and equitable sanitation for everyone around the world. So our aim was to investigate the extent to which WASH full coverage has led to a change in the rates of diarrhea disease among children under 5 in Muchenda. We set out to evaluate what has been done so far to reduce the prevalence and incidence of diarrhea with an aim to devise means of how we can efficiently curb the disease. Like I said, 2030 is the goal. And like you saw in the previous slide, with 946 million people defecating openly, a focus of World Vision was to eradicate open defecation. So what's WASH full coverage, like I mentioned in our aim? This basically looks at water, sanitation, and hygiene, with water supply, water management, and water use, looking at how do you treat this water, how do you manage your water, where is it stored, and what do you use it for? Do you use it for drinking, hand washing, or do you just throw it out? Sanitation, in terms of waste management, specifically looking at open defecation and latrines, and hygiene with the water utilization practices and hand washing behavior. Do we wash our hands before we cook? Like Catherine said, do we wash our hands after we go to the bathroom? Because one of the major causes of diarrhea today is hand to mouth, and this is specifically affecting children who are under 5. Why we chose to look at diarrhea diseases is that it's a leading cause of child and infant mortality in the world right now. It has a direct impact on nutrition, even when food is adequate. Malnutrition is also a leading cause of mortality today, but if diarrhea can cause malnutrition even when food is adequate, that means even if you had food, you would still need sanitation practices in order to make yourself healthy. And inadequate sanitation is estimated to cause 280,000 diarrhea deaths annually. We looked at children under 5 because we feel that this is a standard indicator to track the progress of most interventions. If you're looking at the health of the world, if you're looking at the health of a country, you're going to look at this specific population. We carried out our work in Malawi. This is in Southern Africa. Our study area was north of the capital Lilongwe, in an area called Chulu. X marks the spot of exactly where most of this work was carried out. We chose this area because it had been declared open defecation free in 2013, and we wanted to use it as a microcosm to see whether declaring an area open defecation free would actually mean that diarrhea diseases would decrease around the world. And it also has a 98% WASH coverage, so that was also a good reference point to show that yes, this place is doing so well in WASH, but let's see what has been done to curb diarrhea diseases among the households. So when we looked at the variation of the rates in diarrhea based on open defecation. Before 2013, there was a lot of open defecation in Muchenda, but after 2013, it was declared ODF free. So that meant there is no one who is openly defecating in the area, at least not less than 98% of the people. So what did we find from that? We found that this was before 2013. We would see a rise in diarrhea diseases. But right after 2013, it went down. So it started going down. So we thought to ourselves, we're like, yes, this is what we would expect to be happening. And we had to analyze what factors would encourage the continued decline of diarrhea in these areas, safe water sources and water treatment practices, because they're a major factor of water supply and would aim to reduce the intake of contaminated water, which is a major cause of diarrhea. We looked at the utilization of sanitation facilities, looking at the presence of improved facilities. We wanted to know, why does one area have such a nice latrine and another have a latrine like this? We wanted to look at hygiene practices, looking at who has the access to hand washing facilities. Are you using these hand washing facilities? Do you wash your hands? Because it's safe to say that yes, World Vision is providing tools for you to wash your hands, has told you how to wash your hands, but are you doing it? Do you think it's right, or do you live normally without that? We looked at, or rather one of our recommendations was that a focus on early child development, which is number 3, for better behavior change results. Just to give you a brief of what that means is that let's focus on the children when they're in their early stages of life. 2, 3-year-olds, get them into the mentality of hand washing and proper disposal of human waste in order to prevent the spread of diarrhea. Thank you very much.
Let's give our wonderful panelists another round of applause. All right, so now this is the part where you all can participate and ask the panelists questions. We have about 12, 13 minutes for questions, so don't sit on it because we will run out of time. And I'll bring the mic to you.
Thank you for your presentations. I want to know how you plan on taking your work forward.
So my first step was providing recommendations to World Vision, specifically in the areas we worked. We looked at childhood-based community centers, which is for early child development. And like I'd said, we wanted to focus our interventions on early childhood development. So my recommendation, and I was privileged that World Vision was ready to take up what we recommended, to focus on the childhood-based community centers, because you'd find that these are some of the areas that were even lacking proper sanitation facilities. So focusing on that from the start was my recommendation, and looking forward, we hope that World Vision will carry out that implementation.
I think to add to that, prior to leaving, I was able to write like a community brief that went to the women that I interviewed and the village, not the village health workers, but the group of women that I interviewed. So thinking about ways that they also can take kind of that power themselves to continue to do that work with or without World Vision was also, I think, a piece of continuing that work.
So I am, with the one-page report that I gave to each clinic, it lists areas for improvement in areas of strength for how they were based off the assessment tool. And so those improvement areas allow the communities, the clinics, and World Vision to kind of pick up in order to move the clinic even further. And so while I won't be helping in that process, at least the research that I did, there's a next step for them to follow through with.
Yeah, my experience is going to be similar to Maxine's, where the nature of the barrier analysis is that it provided the community with kind of the ability to spearhead a perpetuation of the activities that we came up with, and so in that way it was a more sustainable way to kind of start things off. And while I also will not be contributing further on, it's hopefully more drama groups will be initiated, and the message of key health messaging will continue on in the same way.
So I had the opportunity to sit down with the regional director for the Southern African countries a couple months ago, and I brought this up to him, the issues that I talked about, and he said that the reason why there's slow progress in Lesotho was because, as I mentioned, that the community-led total sanitation is not implemented there, and it's on the policy side that he mentioned that they're still lobbying for it in Parliament, and it depends on whatever its priority for the current government that's going to be pushed. So I think that a way that I can contribute, if I had the opportunity to take an elective in my 4th year, to be able to go back and kind of work on the policy side. Now I realize that it's not just about erecting facilities, but it's also about pushing the policy aspect of it. So if I can get just a look and experience to see how it's being pushed in Parliament, that would be really good to have, yeah.
I came in a little bit late, and I came in towards the end of the immunizations and the mother seminar. And I was wondering, I heard you make a comment about how there's a distrust of the government or government programs when it comes to immunizations, specifically HIV and AIDS. Is that been a historic trend with all immunizations, or has that been something that has recently come up where women are fearful of leaving their work or leaving their family in order to go and get their child immunizations or get their family immunizations, or whether that has always been that way and it's just slowly getting better as time goes on?
I think there's a mix of things that are happening on the ground. I had the opportunity to go visit a maternity clinic. It was a 3.5-hour drive up a mountain, driving. And the radius that clinic was serving was 10 kilometers. And a lot of people don't have cars. The roads aren't the best quality. So I think that in addition to I wouldn't even say not trusting the government, but the access to those services is hard. Thinking about if you have more than one child, if you do have other household responsibilities, coordinating things, that's about a 6-7 hour walk one way. So it's a day trip. And almost kind of like it's a cost-benefit analysis of like, is my 6-hour, 12-hour walk there and back worth the benefit? On the other side is that I do have these household responsibilities. I do have maybe multiple children. I do have maybe a village to take care of. So I think access to services is definitely a challenge when it comes to prenatal care as well as postnatal care for those reasons.
So one question, this is for all of you, and I don't even mind, I grew up in church, so we're all good. What preparation took place before the intervention was implemented? A lot of times, at least from a Western context, we tend to evaluate for needs, implement an intervention, but don't really take into consideration what happens after that, right? And so I heard some of you talking about resources being available but then being misused or stolen because more immediate needs needed to be met as well. So what preparation took place?
So I saw it done in 2 ways. The first one was the World Vision office was trying to build a water pump. And so they had to go through mountains and valleys to be able to get to the village, and they consulted the town chief and a few elders in the town to kind of help them map the area. That was as much interaction with the community as I had seen for the 6 weeks that I was there. And that was with getting a water pump into the village. But with the latrines, it kind of seemed that World Vision had the plan already done. And so they would take me out to the field, and it was kind of, World Vision had this plan, and they have contractors, private contractors that would build it. So you wouldn't really see a lot of community members around the building of latrines or any of those facilities. But with the water pump, I saw a little bit of that. Yeah.
For our barrier analysis, we had a really wonderful opportunity in that we came into a well-established WASH program that had been doing studies on what the community genuinely needed and had kind of a direct line to people in their communities and the different villages that they served. So when we came in, there was a pretty good picture set in place of the things that the community was struggling with and the things that maybe they needed a different perspective or a different take on. So that was something where we sat down with community health workers, we sat down with our fellow World Vision WASH staff, and we just talked about kind of the context we were in and what people's beliefs were and we basically just had meetings until we then started working on the barrier analysis. But it was to the credit of how strong the WASH program we worked with was, that they had kind of done a lot of the groundwork for us.
Just to add to that, because Kat and I were in the same office, we were, like, within the first week, there were a list of several projects that they wanted us to, that they needed us to work on. And so it was really just a matter of whether or not we had the human capital, skills, and time in order to be able to do those within the time frame that we were there. And so it was really just a matter of, like, finding a project that was, like, somewhat of interest, and that was also going to benefit the community, but it was kind of pre-established before we got there.
I think there's two angles to this. I think there's like usually, from what I noticed, was that there was like a World Vision and Ministry of Health perspective, and then a community perspective that seemed to be at odds in multiple different ways, in the sense that World Vision and the Ministry of Health definitely had the statistics behind and was guiding the way that they seen things happening, where the community kind of had more local on the ground feeling things, where that they felt took more precedent or more priority than the things that World Vision and the Ministry of Health was pushing, in the context of both the village health workers and community leaders that I had the opportunity to speak with. So I think that there is a disconnect between the people on the grounds and the people that see the bigger context of things, and that's always hard to navigate when your day-to-day life there are things in your day-to-day that feels more pressing than the things that these overarching governmental kind of big organizations are pushing.
I really like the question, because that's basically what we had set out to do. We looked at the strategies that World Vision had put forward before, and were trying to assess how far they had come with them. And what we noticed is that the strategies are very good and they were working, but what they involved were behavior change. And behavior change is something that is very complex to deal with. And you'd find that when it came down to the communities, how susceptible these people were to the behavior change, were how much they benefited from it. So you would find that in areas where World Vision had put in place economic empowerment programs, you would find there were better results in the water sanitation and hygiene, because they're benefiting economically, and so now they can take up all these other ideas in behavior change. But when it came to other areas where they're trying to put in things like nutrition first before the economic empowerment, then it was a slow behavior change. So I think the strategies are good, the strategies work, but in terms of behavior change, it's all about how the community will benefit. Just like any behavior, you're not going to tell me to change the behavior unless I'm going to benefit from it. So once these people would see these benefits, then they would change their behaviors.
Hi. Do you think implementing like a behavioral psychologist, like on the ground with you guys, would help anything? Like, kind of trying to come from a villager's perspective and implementing these practices on a more, instead of do this, this, and this kind of way, like make it more, I don't know how to explain it, but like coming from a psychology perspective instead of like hard facts.
Yeah, I think the addition of a behavior psychologist is good, but at the same time, it would be even best if that behavior psychologist is from that community itself, because that's the only way you can actually understand wherever you come from. However much you study, if you haven't lived it, you would never know the final answers.
And I think that's one of the benefits from the barrier analysis, because like you do have that component of just raw data as figuring out like what the doers are doing and what the non-doers are doing and why, and then being able to come back as a community to figure out, to talk about the results, to figure out what would work, and to figure out how to move forward from there. And so that's kind of getting at the psychology without having like an actual psychologist, because we're probably not going to find one within the community.
Yeah, I just want to echo all of the good points that have been brought up. It's definitely important to have someone from the community. Even though I was there with my best intentions, there were still some cultural and language barriers. And you can realize that on the committees, there were town chiefs, moms, pastors, all of those people that people really, they had in the high esteem in the community. Those were the people that were put in areas of authority, of teaching in those communities. So just to echo what's been said, it's really good to have people from the community do it from the ground up.
So we're out of time, and I know that some of you still had questions left, and so maybe the presenters stick behind for maybe 1 or 2 minutes if you want to come up and ask them those questions. But we just want to give them a final round of applause. So thank you. It has been a pleasure to moderate your session, and I hope you all enjoy the rest of your day.
Arts. My name is Al Tedesco, and I direct the Paul F. Harron Graduate Program in Television Management at Westball College, and I'll be your moderator for this panel. The blistery morning should remind us all that when it comes to our global understanding of waste, the winds of change are blowing. The central focus of this panel is the connection between waste and media. There will be 5 presentations, each focused on a small piece of the global mosaic that informs the relationship between media and waste. I ask you to hold your questions for the panel until everyone has presented, when we'll have time for Q&A. So media and waste, what's the connection? Without giving too much away, I want you to know that this team worked on its research and consistently came up with a theme that emerged over and over again, that there's a clear linkage between the revenue models that drive media businesses and waste. At its basic level, the linkage is clear. Even in the age of streaming media like Netflix, Hulu, Amazon Prime, and all the others, advertising still provides the single largest source of revenue for media companies around the world. So why do media companies thrive? Why can they sell advertising? Because advertising delivers attention. Media people are in the business of delivering eyeballs. They want you to look at their content. Advertising works. Advertising drives consumption. Consumption creates waste. I think the link is clear. You can imagine how complex this system of revenue generation and the dynamics around it really are, and that complexity is the underlying theme of this panel. The panelists will introduce themselves and their topics. And thank you very much for joining us this morning. Chris?
So, my name is Christopher Silva, and today we're going to be talking about, to start off, the USA coverage of global waste. So what does that entail? So when we're talking about coverage, we're talking about the news. So there's local news, so your 6 ABC, Fox 29, NBC 10, at least in the Philadelphia area. Your broadcast networks, such as NBC Nightly News, and then cable, so your CNN, Fox News. So just to start off, we'll focus here on Philadelphia and local coverage. So for a city that generates millions of dollars in tourism, Philadelphia holds a notorious litter problem and a dirty reputation, and that's, the nickname Philadelphia. And, residents have rated litter as the second most pressing problem facing the city, and it's pretty clear. I mean, I'm not from Philadelphia. I moved here to attend Drexel from Florida, and the amount of litter here, it's incredible. It's ridiculous. I mean, in my apartment a couple of blocks north of here, I can see trash on people's roofs, which just kind of blows my mind. And so here's just the litter index for 2017. And so the red shows like the high areas of litter and trash, and this is 2018. So clearly it's a problem and it's continuing to grow. And so we look at the local media, the big 4, NBC 10, CBS 3, Fox 29, 6 ABC, they all base their coverage on ratings and kind of driving eyeballs to get, sell advertising. And so a lot of their coverage focuses on traffic and weather, sports. Not really any of it involves waste. And the only channel and station that does is 6 ABC. They have this campaign called Building It Better Together, which focuses on, current impacts affecting the local community. But even though waste is talked about the most under that campaign, it's still only a sliver of all the other things affecting the local community, so it has a tendency to get lost when it's discussed. Now that being said, local coverage both in Philadelphia and across the nation, there are pros, and that is, it provides in-depth reporting. So with national networks, they're going to give you maybe 90 seconds or less of a segment that focuses on waste, whereas with local coverage, they can dedicate all the way up to 5 minutes for an investigative report. And so what that does is create a personal call to action, like the Building It Better Together campaign. It also can provide multiple perspectives, because when there's an issue and they're spending 5 minutes on a segment, say there's an issue with the local recycling company, they'll interview local lawmakers, residents that are being affected, and managers altogether. And then what that can really do is drive the national conversation. But on the flip side, local coverage does have a tendency to have tunnel vision. And what I mean by that is they focus on their little area of the world. So Philadelphia, they're going to mainly talk about that and not the global issues that are going on when it comes to waste. And so because of that, there's a real lack of education, especially on the global issues and things outside of the community. And obviously, as you'll see in national networks and cable networks, they're really driven by ratings and demands. All media pretty much is. And the smaller a market is, the more that demand on ratings is going to be, which is why, waste is kind of put on the back burner to other, areas such as traffic and culture. So now just jumping to the broadcast and cable television side, when it comes to waste in national coverage, it doesn't have its own section. It tends to get lumped into climate change and global warming when it's discussed in the media. And so any type of, research that dives into how much time is being spent in terms of segments on waste is very little, and so it just gets jumped in. And so as you can see, climate change, waste falls under, it has gone up for the most part, but when we dive in deeper, the past couple years, climate coverage and waste has kind of gone down in the major broadcast networks. And when you look even deeper, when they do have climate coverage or waste coverage, the amount of time spent on actual solutions to the problem is very minimal. And so overall, there's just a downplay of waste in the media. And so when waste is talked about, it's put towards year-end reports. That's when the most time it's dedicated to. And so a great example would be the EPA Recycling Summit, which was started a couple years ago, and it gathered industries, economic, environmental leaders together to discuss national recycling policy. And when it happened, it received little media coverage. In fact, ABC, CBS, and NBC contained around 2 minutes or less for their segments for the entire year about it. And so when we talk about, okay, how does media present waste when it's in the public, to the public, it's two ways. The first is dumping grounds. So dumping grounds, you see in the picture, it's just kind of these bizarre, strange places of all this trash piled up, and it's always on location in foreign nations. So you'll see the effect in China or less developing countries. And what this ends up doing to the viewer is creates an estrangement, because it doesn't allow U.S. viewers to develop a personal connection, because it's just so out of their little idea of their world. And so it creates a West versus rest mentality. And then the other side is domestic recyclers. So when they're not focusing on dumping grounds, they're focusing on, okay, how does this affect domestic recyclers like Waste Management, a huge company? And when they do, they always focus on expertise and revenue rather than the actual global environment justice that are happening. So driving factors behind this, just like local, it's going to be demand for higher ratings and revenue. That's, a big thing that's with media, and the bigger that a market is, the more that emphasizes. And then obviously, especially recently, what's driving the ratings and revenue is political atmosphere. So have a gift for Trump, but I feel like, it's been an increasing proponent in the media for recent years. And so what ends up happening is when the media discusses waste, there's always a political bent to it, And so just to kind of illustrate that, this is how waste is really talked about in the public.
Long time ago. Banning plastic straws. I do think we have bigger problems than plastic straws. It's interesting about plastic straws. So you have a little straw. But what about the plates, the wrappers, and everything else that are much bigger, and they're made of the same material? So the straws are interesting. Everybody focuses on the straws. There's a lot of other things to focus, but it's an interesting question.
So I had that clip up there really just to kind of illustrate how waste is talked about in national coverage. It's usually as a punching bag to any of the political atmosphere going around, or like in this case, Trump. That, what he's talking about in terms of plastic straws, there is a conversation to be had on plastic straws and how they affect, the world in relation to other plastic items. But they're not diving into that. They're just looking at what he said and kind of ridiculing it. Whether it's right or wrong, they're not educating it beyond that. They're just using waste as kind of like a punching bag.
Long time ago.
Let's see. Other concerns. Here's a picture of Kim and Kanye that I pulled up. This is actually from Yahoo Finance, which says a lot about their site. But the reason why I have that up there is because, in an 18-month period 3 years ago, TV and print outlets gave 40 times more coverage to the Kardashians than the acidification of oceans and trash that's in the oceans. And so what that kind of shows is that media, whether it's national or local, has a tendency to focus on fluff, and that's what pushes waste to the other side. And then the other hand of that is sensationalism. So they want to play up the dramatic. So case in point, the video of Trump. They're playing up the dramatic of what he's saying rather than educating the public on what he's talking about. And so obviously from all this, what it creates, I'm sure everyone knows, there's been a lack of trust by Americans in mass media in general that's been declining over the years. So because Americans hold little trust and confidence in the media, it makes them question what they're being presented when waste is talked about. But that being said, I feel like I've really talked about media in a negative light. And while they can do more to provide better coverage of waste, I will say this, they are the best way of reaching the public at large and educating them. And the thing is that we as viewers are also, it's a reciprocal relationship. It goes back and forth. They're going to post dramatic, sensationalist stories over waste in general because we as viewers watch it, we accept it, and that's what we want to see. We want to see something that gets us going. But, both media and viewers need to do a better job of focusing on what really matters, and that's education. So next up, I'm going to introduce Theano, talk about Greek media waste.
Hello, everyone. I'm Theano Karavangelis. I'm originally from Greece, and we are going to talk about the coverage of waste by the Greek media. And specifically, I'm focusing on public broadcasting and the promotion of waste management and public broadcasting actually leveraging new media and digital media in order to promote their initiatives. So when we think about public broadcasting, we would be like, who watches public television these days? Well, the difference with Greece is that the people actually value their objective reporting and their transparency, and opposed to the private channels that are favoring their political allies. So ERT is the Hellenic Broadcasting Corporation, and it continuously advocates for waste and waste management and the environment. So it started its operations in 1930, and initially as a radio broadcasting station, and then it evolved into the television landscape, and it's been through its ups and downs. So the government ceased its transmission in 2013 due to the financial and political crisis. So at that time, for 2 years approximately, journalism was facing a very acute crisis. It also had to deal with that in addition to politics and the economy, which was a really significant problem. So in 2015, the new government reopened ERT and focused on its reorganization with a new administration, and it consistently focused on humanity, the environment, and society. And because it is funded through a license fee that is given by the citizens' electricity bill, so they don't have that obligation to cover politics. So these two graphs illustrate the news sources that Greeks rely on and use the most. So for social media, Facebook comprises the largest portion because it's like the heart of social aggregation and conversation where people are not afraid to express their opinion about the environment and the ineffective policies that the government implements or no policies at all. And then pertaining to television, we have the 4 private channels and ERT. And as you can see, the audience is equally spread out because the public actually values their transparent reporting. And the only reason why all the other private channels are receiving attention is because of their entertaining programming. So ERT has been trying to establish a strong ecological footprint, and they don't just dryly provide information or news. They leverage their resources and their expertise in order to create meaningful stories and to alarm people to take action for the environment. And they focus a lot on the pollution of the Mediterranean, which is a very severe issue. And waste in the Mediterranean has been dramatically increasing. So, yeah, I will show you a video.
Look at this colorful seabed. It sways back and forth in the clear water off Greece's Andros Island. But wait, take a closer look. Divers were less than pleased with what they discovered.
It was different colored bags waving around in the sea, and it was a very scary thing to see. It really shook me, and I think it shook everyone who saw it.
This colorful reef is actually under siege by discarded plastic bags in otherwise clear water.
If you can imagine like the paradise of like the Caribbean seas where you find coral reefs everywhere of every color, it was the exact same thing, but instead of corals, it was bags.
Groups like AG and Rebreath target coastal waters for cleanup. They remove a seemingly endless supply of trash and test pollution levels in the water.
We used to have this idea that, okay, the ocean is immense, it's huge, and you can just throw something in there and there will be no side effects. But the thing with microplastics is they work as magnets, and they hold on to chemicals and hormones which they find in the water. And that goes into the food chain, and it's in the fish that we eat, and it's everywhere around us, and it's toxic to us.
Divers removed 300 kilograms of discarded fishing nets. They also pulled up dozens of kilograms of discarded plastic tangled between reefs, but note they only managed to remove a fraction of what was there. Look at...
Okay, so you can understand how severe the accumulation of plastic bags is in the Mediterranean, and no one is doing anything about it, especially the government. So expanding on public television's role in the environment, we have ERT Social Responsibility, which is the online platform, which is continuously improving, and they are actually, they have a vast archive of articles, publications, and documentaries, and it's where they add all of their projects and their events connected to the environment and waste management. They're also participating in international projects, for example, the 17 Goals for Sustainability with the United process and shared on social media. And last, we have the Public Ashtray Project, which is an innovative project that was created by a group of activists and engineers. And their objective is to eliminate cigarette butts that are thrown in public, and also to raise awareness about the toxicity of cigarettes to animals and people in general. The only concern is that about 50,000 cigarettes are estimated to be recycled by 2020, which is a really small number compared to the 3 million people that live in Athens. So I think that the main reason why this is happening is because there's not enough coverage from media. It has gone viral on social media, but it's really difficult for something like this to stay in the forefront, especially when social media moves so fast. And if this is a viable solution, it depends on if the media actually embraces this project and communicates the benefits of continuing to build innovations like this. And also if the inventors themselves embrace new media and communicate their objectives and also expand this project to other cities as well. Okay, thank you very much.
Hello, my name is Alexis Vandeventer, and I'm going to talk to you about social media's role in all of this, at least a brief overview, because there's a lot to when it comes to social media, especially because as the years go on, people's consumption of media just continues to rise. As of right now, the average person spends 11 hours a day with media across all platforms: physical, social, TV. And then, so young adults, media interaction is 43% digital, and 64% of adults check social media once a day. So it's a very large platform that can be used to address this issue. And this is data from Pew Research Center about the percentage of adults that use social networking by separated out into different demographics. And as you can see, the younger demographics use social media and social networking sites more than older demographics. And social media in itself is driven by advertising. It's how social media platforms make their money. It's how influencers make their money. Social media is also an integral part of pretty much every advertising and marketing campaign for companies now. And they use both their own company-owned accounts and influencers to get their message out there. All kinds of companies, from Kellogg's to clothing brands, cosmetic companies, pay influencers even just to pose with their products to create demand for them and increase their sales. And this is really leading to overconsumption, which is the real issue when it comes to waste, because obviously we have to consume products as people to keep surviving, but overconsumption is what has led to the abundance of waste, and that's also fueled by online shopping and this convenience economy that we're living in. And companies are also sending an abundance of products to these influencers to try to get them to post about them and talk about them to their audience, which leads to even more waste because these people now have a lot of packaging and products that they never touch just sitting in their homes that they have to end up throwing out. So looking at the waste that is produced because of social media and this demand created by social media, a big part of that is packaging of products. And as you can see from this picture, and also a million other posts that you will see on Twitter and Facebook, the packaging when you order something online is often really large and excessive compared to the product. So as you can see in the photo on the right, how small this feather duster is compared to the box and then all of the additional packaging inside. And this causes some consumers to feel responsible for the amount of waste. However, about 100 companies are really responsible for almost 3/4 of waste and emissions that are causing these global issues and global warming. And as like I said, packaging is really the main focus on social media, and the EPA estimates that it is 23% of landfill waste as of right now. So there's this dichotomy of people feel guilty and this, overconsumption and convenience economy, but can people actually make a difference? Are we really the problem? The big trend that's popping up on social media to try to reduce waste and make people make different choices is this zero waste trend, which really is a grassroots movement that is being led by consumers, and this has caused a lot of zero waste shops to open up in different cities across the globe as well as online. And the rise of this movement coincides with the mounting evidence about the impact of climate change overall, not just waste. And there are also a lot of influencers now that focus on zero waste living, and they're really becoming very popular and viral on platforms. However, they're still advertising products for companies, and they're making their money from these companies so that they can increase their sales. So it's just another dichotomy of, yes, they're promoting this way of living that reduces waste, but they also need people to continue to buy products that they might not need so they can make a living. And then, is this even causing a change? Is this having an actual effect? There's no data that suggests one way or another, but if you look at specific companies, there are some companies that directly respond to their consumers and make changes based on their consumers' complaints or, post, like when they post, the cosmetics company Glossier, as you can see this response to a customer, this customer raised a concern about the excessive packaging that they felt came with every order, because every order from this company comes with at least one pink plastic bubble wrap pouch. And so the company now offers a limited packaging option when shopping online with them, as well as a way to recycle in their brick and mortar stores. But also a lot of zero wasters cite media stories and social media as their final push to make a lifestyle change. So at least it seems to be having at least some effect on the personal level for people. And then there are companies like Unilever, Nestle, and Pepsi that are testing reusable packaging. They're not really, you don't really see a lot of the posts from them about these tests, but people assume that this is happening because of consumer awareness and the consumers raising these concerns, and they're testing this packaging for their brands like Haagen-Dazs, Axe and Dove deodorant, as well as different shampoos. So, and then just to close, this is a quote from a woman that owns a zero waste shop in Toronto. And she said, many of the people that come to our pop-up shops say they found us online or are already following us on Instagram. It's more than just social media, though. The media is consistently publishing stories about waste management and plastic pollution, and that's contributing to the everyday consumer being interested even more. So whether or not these personal decisions are gonna have an effect and make a positive change on the global scale, media at least is having people become more aware and make more conscious decisions in their everyday lives.
Hello, my name is Shelly Thomas, and I'm going to be talking about the recycling mythology and e-waste or electronic waste. A lot of our panels talked about coverage and how waste is talked about in media specifically, but this is going to focus more on the physical contribution that media has to waste. Because everything that involves media needs devices. The creation for media and the distribution of it, and those devices are obviously going to go somewhere. So to talk about a few of the different myths that people talk about, so understanding who recycles. Everybody recycles, but not everybody recycles electronic waste specifically. So people don't necessarily know that they need to deal with cell phones or computers differently than they would normal plastic and paper, because they can't really be recycled the same way. And then where does it go after you recycle? A lot of people think that if you put it in in your regular trash can, that the city will then separate things out, but that's actually not true, and regulations have actually increased. So there's so different cities now are actually fining people for doing that because it's filling landfills, and landfills are now banning that kind of materials because it's causing more problems, which I'll get into later. So, and then why do you do it? Generally, a lot of people think, oh, they're recycling, they're doing good for the environment, but there's a lot more effects that people don't realize they're actually having, especially with electronic stuff, that's important to get into. So when it comes to e-waste, there's generally two major topics, or two major causes of it. So that technology, the first one is that technology moves fast. So every year there's new media, every year there's a new iPhone, every year there's a new thing that everybody wants to have, a new tablet. And so everyone gets rid of their old stuff, and you have to figure out where that's going to go. And that causes that increase of waste. And the other thing is that when we consume, we throw it away. So of course that's going to go somewhere. Phones and cell phones are one of the highest contributors to this, which is why I also added in that fact of that 350,000 phones are thrown away daily, and that number goes up all the time, and that causes even more issues. Phones specifically can be very damaging. If you look here, I have a list of the components that are in a cell phone that go along inside their battery packs, inside all of the different technology behind it. Things like cobalt and lead and silver and lithium, all in high concentrations when they're put in landfills, cause severe pollution issues. Here's a picture of just a landfill of various transmitters, and that can increase a lot of that pollution. And cell phones, as you can see, when they're improperly disposed of, like in this picture, they have those battery packs connected, they have all those things connected, and the components in it, the lead, the cobalt, seep through into the floor or into the ground, into the air. When it's hot out, depends, all kinds of things. They seep into water, and it can cause heart issues, kidney issues, brain function issues when people drink that water because it gets in that way, or the air, when people breathe the air. And of course in the soil, then it causes plant life to falter as well. This is especially an issue when it comes internationally, because a lot of people don't realize who they're donating when they do donate. They don't realize who they donate their electronics to. And so a lot of that waste sometimes ends up becoming international issues because U.S. will ship and dump them in other places such as China and India and overwhelm them with issues. In fact, in China, about 7 in 10 children have too much lead in their body from this pollution, and it's only increasing. So what are some of the goals that you want to focus on? So you don't want to, the main thing is that you shouldn't stop what you're doing. You want to continue to recycle your paper, your plastic, and separate it out, but you need to become educated on how to do it with media as well. So some of the main ways to do it, the 4 general ways that you should focus on how to properly deal with media is go to a certified recycling center. You can Google them. There's one in every local area. People don't realize they're there, but they are. There's an organization called Basel Action Network, or BAN for short, that certifies each one of these areas, making sure they're not going to be exported to international locations, and they're not going to be falsely put into landfills instead. And so they will take care of it that way. Another thing is that you can go to local institutions such as schools, government buildings, and churches often have drop-off days and drop-off recycling times that you can go and put your materials that way. With those, you want to be careful that they know how they're recycling it, because once again, it can be falsely put into more of a dangerous situation that way. And then other things is a lot of people don't realize that most manufacturers of electronics have a way that you have a system where you can send it back to them and they will dispose of it properly. So if you get a new iPhone, often you can send another one back to Apple and they will dispose of it properly so that it's not causing extreme amount of waste. Or they could refurbish the materials because the hardware may still be good even though the software's not, and they can reuse that battery in another example in the future. And so those kind of methods are really important to use. So those are the kind of ways you need to just educate yourself on how to deal with that. And then consumption in general, just know it's not going away. People are going to continue consuming. Of course, as we mentioned, consumption is still being driven. So you need to, if you're going to continue to consume, just make sure you're doing so responsibly. Using your voice and media to make those changes will help. So some of the things you can do, as I said, just to wrap up, is incorporate your change in society. Make it more, it needs to be more regular, because most of it comes from that lack of education that nobody really knows what to do with these devices. So it needs to become more of a regular thing that people know how to handle it when they become, when they use more and more different devices, new tablets, new computers. They trade these things off every year. And then writing to your political officials and voting about what you know. Get educated about what you're talking about, and then making those regulations. Because as I said, only about 20 states have current bans in their landfills for these materials, but more and more are working on this every day. But currently there's no national, regulations or laws dealing with this, even though it's causing serious national issues. And then continuing, as I said, with your regular recycling, keep making sure it's a normal part of your daily routine. And then making your informed supply chain decisions. You want to make sure that every decision you're making is purposeful when it comes to your media, because the consumption of that, media doesn't go away. It's going to sit in that landfill forever. It's one of those things that if you're going to use it, you need to make sure you're doing so responsibly.
Hello everyone, I'm Sanjana Babu, and I'll be talking about Indian media and waste issues. So let's start off. Amongst all the news related to politics, movies and cricket, Indian media does focus on environmental issues, and it's kind of a little less. It's not a lot, but they do focus. And the primary reason behind this, I will be explaining it further. So what are the different kinds of waste issues related news that we see? That waste disposed into our rivers and water bodies. So that's an example of our Ganga river as to how unmanaged the waste is being disposed. And this is South India, where we don't see snow at all, and this is not snow. This is the chemicals being released into our beaches. And that's how waste is not managed properly, and these are the stories that's being covered by Indian media. And so in 2014, the government of India starts a campaign known as Clean India. So with this Clean India, we have a lot of media and news channels supporting the government of India for it, and that's why we see an increased number of news with regards to waste and environmental issues, and that's why you see 30% and 20% of news related to waste. And so there is one particular news channel that took and showed the power of media to the rest of the world, like how they can bring in brands related to cleaning products, and how this could be more of a brand advertising, bring in celebrities in order to inspire people to take up waste management and do a more efficient waste management. So this is the effects of how powerful media can be. This is our Amitabh Bachchan, who kind of earns like millions for just 5 minutes of appearance on screen. So someone like that, a news channel can bring him to the streets to clean the streets of India for a day, not permanently. So this actually inspires a lot of his fans. People who follow him on social media get inspired and then start thinking about how efficiently they can manage waste, how they can keep their surroundings clean. So this is our prominent citizens of Mumbai who have taken up the initiative to clean up the beaches and also tell the people and citizens as to how they can efficiently manage waste and keep their surroundings clean. This is a small
A big
news
story
clip.
from Mumbai, inspired by Afroz Shah, who's now well recognized for organizing massive cleanups. Another Mumbai citizen has taken up the task to clean up Mumbai's Dadar beach, and it seems the results are showing as the cleanup enters its 100th week. Actors Esha Gupta and Naveli Deshmukh joined Chinu Kabatra on this milestone. Now, Saurabh Gupta brings us this ground report.
We are at the Dadar beach where a massive beach cleanup program is in progress. Now this is the 100th week of the Dadar beach cleanup, and as an effort to mark that milestone, 100 other cleanups are being organized all across Mumbai. Now the man behind all of this is of course Chinu, but joining him today is also actor Esha Gupta and Naveli Deshmukh, who's also here. All prominent citizens of Mumbai, more so. Chinu, to you first. 100 weeks is quite an awesome milestone.
Yeah, definitely. I feel like Kohli today. I feel like Dhoni today that I have hit a century, my first century. But yes, we have to hit more centuries to clean our oceans.
There are a lot of Mumbaikars over here right now who are supporting, and I think it's beautiful to see that because everyone is realizing that we need to make a difference today to actually have a tomorrow. And like you can see, like we've been digging since we've come here, and they are actually diggers. The only reason because the plastic is all the way inside. On the surface it looks clean, and you know, this is, I mean, it's just so sad that if we don't do it today, like tomorrow the whole planet is just going to be plastic.
How do you feel about this cleanup? What more do you think needs to be done?
I think, you know, this is a great initiative. But at the same time, I also feel that you don't have to do it just one day. This has to go on always. And this one day is for the awareness that how important it is to keep our earth clean and how important it is to have a clean and safer planet. So I feel that it's just a day for awareness, but this we have to take a responsibility as an individual और एक citizen, responsible citizen होके हर दिन इसको implement होना चाहिए. That only then the change will come.
Thank you so much for speaking to NDTV.
Thank you so much.
So obviously celebrities, citizens and Mumbaikars are out here on a Sunday morning cleaning the beach, and perhaps that's a message to all Mumbaikars that we need to clean up our beaches. Plastic is everywhere, pollution is everywhere, but the battle against plastic pollution is also on. In Mumbai, Saurabh Gupta.
So we see how powerful the media can be and how they can bring celebrities to influence common people. So sometimes people do take advantage of it. The very same celebrities, the very same Indian movie stars, also known as the Bollywood movie stars, take advantage of it. They kind of do a free promotion of their movies because they have low marketing budget. So it's a nice way, like, not nice way though. They just take the broom and start cleaning and indirectly gain a lot of media attraction and promote their movies for free. So, which is not something that you see as a solution to manage and clean waste. So what did the public think of Clean India initiative by the media? So people strongly believe that yes, celebrities did influence them. People they looked up to were doing something regarding waste management, and they were also inspired to take that as an take up an action against waste. But they also believed that it was mainly done for just publicity. It was not done for some real reason. They were not doing it to find a solution to waste. It was just done for media to gain advertisers and celebrities to gain more views of their movies. So it was just a publicity. So when you come to the long-term solution with regards to the media, we see that the campaign ran from just 2014 to 2019. It was just 5 years, after which the budget that was sanctioned for advertising or waste-related issues reduced, and nobody's still interested to promote waste management. So, and actors and actresses moved on to the next projects and next films, and so no more waste management. So media kind of has a very short time limitations for bringing about solution and creating awareness among people. But then we have social media coming to the rescue, where environmentalists and social activists are given the power to create awareness among their own community. And so people are now more aware about as to what happens around them, rather than knowing what happens nationally. Through social media, they know what happens in their very own supermarkets. So this was one social media page where they showed how much of plastic is being disposed inefficiently in a local supermarket. So people of that area can actually reduce the number of plastic and put an end to the plastic that's being generated. So social media does see a lot of success when compared to media. We see through a social media campaign, we see of social media campaign of waste management, how they can empower rural women, how they can give them a source of income. And it's not just for publicity, but actually do something with a real goal. So when I spoke about media and how they just time limited just for 5 years. So on social media, we see how even till today we still see this youth of Mumbai who conduct various cleanathons. We are no longer conducting marathons and walkathons, we're conducting cleanathons to clean our beaches. And the latest cleanathon was conducted on 22nd February, not far from now. And so social media can actually have real results when compared to media. So when national media, we have other stories related to politics, cricket, and Indian Premier League, and movies and superstars. So they have to move on to the next big thing. They can't just stick around to waste management, and that's kind of boring. Nobody really wants to listen to waste management when compared to movies and cricket. So with the increasing number of social media users, not just in India, all around the world, I think there are more number of users of social media. Social media can be the best way to create awareness about waste management and also help influence people of a particular community. I understand that social media does not create a big impact like how media can. Media can bring in celebrities and create national awareness. Social media has a limitation of only creating awareness among your community, a small area, but it's more effective when compared to media. So that's it. Thank you.
I want to thank the panel. We have a few minutes before lunch for questions. Please.
In reference to social media and content consumption, do you think it's enough to be able to trick people into being more sustainable? For example, if you're selling a product as an influencer, selling something from a big brand like this to a shop, is it enough to do that without telling the audience the purpose of that? Or would it be more effective for people to learn about
I think being upfront about it is really what makes those influencers effective. Like just looking at the different people that are, when they talk about being like, oh, I'm a sustainable or zero waste influencer versus just like an influencer that is promoting sustainable products, I think that label does have a bigger effect.
Other questions? We answered all your questions. That's pretty good. Well, let me thank you once again for coming. The panel will be here for a few minutes, and give yourself a round of applause.
sleep here. I was like, love that. Because then I was like, if I go to California, I was like, oh, it's fine. I'll just need a place to live. I have to find that within a month. It's great. Yeah. Worst comes to worst, you Airbnb it for a month and you just hop. Seriously.
Thanks everyone for joining us today. Can you hear me okay? Can you kind of hear me? Can you hear me now? Yes, all right, thank you. Thanks for joining us on this panel. We have 5 really great talks for you today. The format of the panel is each person's going to speak for about 7 to 8 minutes, and I'd like you to write down any notes you have for questions and hold on to those till the end. We'll have about 15 to 20 minutes at the end for Q&A. So right now, I would like to introduce everyone that will be speaking. First up, we have Tim Hanlon. He's a junior in bio and currently the chair of the Undergraduate Student Government Association's Sustainability Committee. And he works alongside students, faculty, staff, and administration to increase sustainable efforts on and around campus. So if you've seen that petition circulating to get us a gosh dang sustainability program, you should sign it. Next up, we have Juliana Rudnick. She's originally from Philadelphia and is a second-year global studies student with a concentration in global justice and human rights. She's interested in exploring the intersection between art and justice on a grassroots level. Following Juliana, we have Rachel Sasson. She is a second-year architecture major minoring in sustainability. Her presentation today stems from work done in a sustainability history and theory class. Then we have Mary Mastro Batista, and she is a graduate student working on not 1 but 2 master's degrees in the interior architecture and design research programs, and her research considers sustainable solutions to improving educational environments. And then last but not least, we have Ashley Richardson, who's a junior studying interior design with a minor in sustainability in the built environment. Let's everyone give our speakers a big welcoming opening applause. Okay, and Tim, let's have you present.
All right. Good afternoon, everyone. Thank you for coming to this event. I think it's a really great purpose, and I'm excited to hear what everyone else has to share today. So as Jen had mentioned, I am the chair of the Student Government's Sustainability Committee, and so today I'll be talking about some of the things that we've been working on, along with things we've done in the past. So right now, again, as Jen alluded to, our biggest project is to push for an Office of Sustainability here on campus. So 2 years ago, I began these conversations with upper administration and gave them our first proposal, but ultimately that was denied. And so now we're pushing again with a much more significant proposal outlining things going on in the community, what student groups are doing, what faculty and staff are doing, to show that there is a widespread need for such a centralized office. And this office would act to make sure that there isn't repetition in work, to help amplify the work that's being done, to help further conversations with the community and within Drexel as well. So if you'd like to sign and support, a little shameless plug here, here's the link to do so. So one of our most outwardly facing outreach kind of initiatives is community cleanups. And so we started these back in November of 2019, and we are doing these in association with other students and student groups. So this is our first one. We had about 27 people show up for this, and we were able to collect 30 of the big, large black trash bags worth of trash from the Powelton Village area. And so our goal is to make this a termly event happening at least once a term, hopefully more than that. And I had attended the Powelton Village meeting last month, and they had mentioned doing community cleanups on their own. So I think it's going to be very beneficial in the future to continue these efforts with the community to build relations, to help educate people on the proper way to dispose of trash, how to make sure that we don't have to continue doing these cleanups if there's no trash, which would be ideal. To add to this, the Academy of Natural Sciences also just created a partnership with United by Blue, and they have a goal of removing 25,000 pounds from the Delaware River throughout the next 3 months. And so United by Blue individually will take out 1 pound of trash from the Earth's waterways with every product you buy from them. And in the past several years, they've been able to collect more than 2 million pounds of trash. And so through collaborative efforts between all of these groups, I believe we can really amplify the effects of the community cleanups happening on Drexel's campus, near Drexel's campus, and beyond to make a much more cleaner and healthier environment. Dining facilities. So we have a number of programs that we're running in the facilities. This is just a number of them. And so the Aussie reusable containers is the green container you can see here on the screen. And we fully instituted these this past fall. Prior to that, there was only disposable containers. And so anytime someone would take food out of the dining hall, everything's thrown away. However, now with the reusable containers, any member that is on the dining plan has the option to use these containers in the Hans Dining Center free of charge, and we've been able to eliminate a lot of waste through that. Also, trayless dining, so we remove trays in dining facilities, and this has helped eliminate decrease food waste and water waste as well. Additionally, and I think the most interesting of all these is the biodigester we've put in the Hans dining facility, and this takes any and all food waste from the facility and grinds it down into a liquid form and sends it to the water department. And the water department is then able to harvest it out and use it to create heat and energy to serve the greater community. On top of that, we've instituted a reusable bag incentive program in Northside Dining Terrace, so if you use a reusable bag, you get 25 cents off. And the last one I've listed, I'll talk most about, is the Companion program. So the Companion program is through a third-party company, and they specialize in using reusable bottles. And so every time someone uses one of their bottles and scans a barcode that comes with it, they donate a cup of water to a third world country or community in need of water. And so students here at Drexel, when they scan their bottle, are able to earn points and eventually enter raffles to get things like gift cards, free food, promotions, things like that. And as the screenshot here shows, we can use this to also track the statistics happening here at Drexel. And so since fall, there have been about 1,700 scans of these barcodes, but obviously reusable bottles have been used significantly larger amount of times. So this is just a small percentage of what the actual numbers would look like. And if you want to use a reusable bottle, there is a thing on the Drexel One app that shows you exactly where all the hydration stations are around campus by going to the app, and then on the menu on the left side, click Other Places, 3 dots in the bottom, and then you can click Hydration Stations. So obviously there's a lot of work being done and a lot of work that we need to continue to do. So if you have any questions, comments, concerns that you want to bring to student government, to the Sustainability Committee as well, feel free to email me, or there is our link to sign the petition. Thank you.
All right, thanks so much for that, Tim. That was great. Next up, we have Juliana. And Juliana's talk today is called Revaluing Trash, a case study on the power of recycled artists in residency programs.
Great. Hello, good afternoon. Thanks for joining us. I'm Juliana, and this fall I had the opportunity to visit a landfill recycling center in Northeast Philadelphia that has, sorry, technical difficulties. Oh, you know what? Okay. Sorry about that. Yeah, so I had the opportunity to visit a Recycling and Waste Management Center in Northeast Philadelphia that challenge us to consider how to revalue and rethink about how waste affects our daily lives. So before understanding how we can reposition waste within our society, I would like to just talk about what we know about our waste crisis. So we know we have a waste problem, and this is partly due to our adoption of a throwaway culture. Our single-use plastics have brought great convenience to people around the world. However, it's caused a massive uptick in the plastic that now sits in our landfills. More on this, we have actively disassociated from the waste we have created. It's easy to take away our trash from the spaces we inhabit and send them to landfills that often sit at just outside city limits or in lower income areas. And it's easy to fall into the culture of complacency that absolves each individual from our responsibility to waste. And even more so, our recycling system is currently broken. It severs the relationship between the individual and the waste we have created. As much as it may feel good to separate the waste that we create, separating glass bottles and plastic from waste, food waste, it's not a systematic nor transformative way that's actively allowing us to solve our waste system and problem on an international level. And lastly, our zero waste movement and lifestyle that has taken over our social media and lives deserves great praise and recognition for the amount of work it does to raise awareness for the importance of producing a cleaner environment in the future. However, the movement itself is still rooted in socioeconomic status and privilege and also perpetuates gender norms that we must be aware of. Knowing this, we must reframe waste in a more productive way. I propose that we do this by implementing more community art programs within the local and global level. And this brings me to RARE. So RARE is a recycled artist in residency program located in Northeast Philadelphia on Revolution Recovery, which is a recycling waste facility that specifically handles construction and demolition waste. RARE's mission is to connect the individual to the waste that they have created. It challenges the perception of waste by creating this unique platform that allows artists to use over 450 tons of material that's delivered to Revolution Recovery every day and creating new artworks scaling from sculptures to different kinds of media works on campus that allows them to create this social commentary on challenging individuals to think about how we think about waste and understanding the reason why we have such a great production of it. The hope for RARE is to encourage a broad range of people to think differently about the collection and disposal of materials through art installations around the property. However, one of the most productive stances that RARE has is its impact on the community itself. Situated in Philadelphia, RARE's mission to integrate the community within the landfill is extremely important. The RARE is situated on many acres on a Superfund site within Northeast Philadelphia, and it allows the community to come and attend things like community dinners, concerts, and more, actively integrating the community within the spaces that our waste inhabits. Even more so, RARE also communicates with other community organizations throughout the Philadelphia region, also working with art institutions like the Philadelphia Museum of Art, and then also Tyler School of Art. These programs allow materials from RARE to be used for community outreach. For example, in the middle picture you see basketball bleachers being repaired and painted by lumber supplied by RARE. And what RARE also shows us is that waste is not a fixed category of things. We must deny the idea that waste is a producer of just dirt and pollution and actually see it as something that's able to regrow and become something of more import. If we change our perspective of what trash is to what trash can become, waste production will ultimately decrease. And even more so on the life cycle of waste, you see some of the art projects and installations on the left-hand side that have been created over the past 3 years at RARE. And these show that waste can really become something beautiful and something that was previously denied and seen as valueless can actually be revitalized into something that we do see as beautiful and monumental. And RARE is not alone in this mission. There are a lot of other communities and organizations that are leading the revolution of value across the nation. These include Recology in San Francisco. Recology is another recycled artist in residency program that RARE was also inspired by. This program started in 1990 and RARE followed just in 2010. In Detroit, Michigan, at Four Corners Landfill, construction workers and landfill workers scavenge not for necessity, but for opportunity. Even though they make higher than average salaries, they find value in wasted products. And then again in Philadelphia, you see a lot of community organizations that stem from collaboration, art, and sustainability, such as Trash Academy, Restored Spaces, and Trash Can Takeover. And even more so, there's many international programs, such as the Trash Pirates, that go to music festivals across the world and actively try to seek discomfort, wearing trash that's been created at these music festivals and attempt to challenge the framework of what is valued and what is not. And Wasteland by Vic Muniz is a documentary of his work in Brazil, photographing landfill workers. And this work fosters a stronger, deeper connection between the individual and the way our collective waste can possibly reform our relationship with it. So why art and community? Why can this be one of the reasons and possibilities to solve our waste crisis? By inhabiting the same spaces our trash lives, we'll begin to redefine our relationship to the objects. Seeing the waste we create will help reassign value to our trash materials. And the construct of waste is just as malleable as society's opinion of what is and what is not art. The flexibility of value only requires innovation and creativity, as you've seen in RARE. And what is most important is the idea of collective responsibility and valuing it over individual action. As we go forward into the future, looking towards a zero waste future, we must understand that collective responsibility is going to outweigh any individual effort. So community art programs like RARE are definitely influential in contributing to this idea. Thank you.
Woohoo! Thank you so much, Juliana. That was so great. All right, next up, we have Rachel Sasson, whose talk is called Race to Zero Waste, Philadelphia.
Hi, everyone. So I looked at cities working towards circular economies and compared their progress and success to Philadelphia's current situation and goal towards zero waste. So to briefly define a circular economy, it's an economy in which the life cycle of a product or material is prolonged for as long as possible, as opposed to the traditional make, use, dispose cycle. So today I'll further examine Osaka, Japan, Songdo, South Korea, San Francisco, California, and Vancouver, Canada, and determine which aspects of their work towards zero waste may be applied here in Philadelphia. So Japan's work in sustainability has always been a model for the rest of the world. Osaka specifically deals with an extremely dense population and immense consumption of plastic, which poses challenges in the waste management sector. The city's main solution to these problems is incineration. So every day, Osaka's Mishima incineration plant burns around 900 tons of garbage and generates electricity for 125,000 households. The plant also provides tours and waste education programs for visitors. A huge downside to incineration, however, is dioxin emission, of course, but by implementing strict guidelines and introducing advancements in technology, Japan was able to reduce dioxin emissions by 98% since the year 2000. So last year it came out that Philadelphia incinerates a lot of its waste, which caused a large public outcry. While Philadelphia uses similar processes for incineration, they lack proper prevention methods for dioxin emissions, which is something that they could work on. Songdo, South Korea was conceptualized in 2001 as a smart city in which advanced technology collects data to monitor resources and trends, including waste management. The walkable city limits need for cars and contains the highest concentration of LEED certified space in the world. And what's most unique about Songdo is its pneumatic waste collection system. So it's where these high pressure tubes transport waste to underground collection centers where it's sorted and mostly incinerated. The waste collection bins are placed around the city in public areas and on streets, as well as within residential and commercial buildings. Coal and nuclear energy still comprise 70% of South Korea's energy, and they recognize the importance of transitioning to renewable energy resources. In Philadelphia, a system as drastic as this might receive resistance or result in misuse by residents. In addition, Songdo is far less populated and less dense in comparison to Philadelphia, making it easier for the system to be successful in Songdo. Finally, implementing this cutting-edge system in Philadelphia would be very difficult within the existing historic infrastructure, but a smaller scale system modeled after Songdo has potential in new developments. Compared to other cities with lots of private companies competing for customers, San Francisco has an exclusive partnership with Recology as a waste management provider. This allows for a lot less friction and more experimentation. Recology also has a strong financial incentive to divert waste from landfills. In 1989, with a diversion rate of 10%, San Francisco began a zero waste initiative. In the following years, they released a series of legislation and educational programs, leading to, in 2009, the San Francisco Recycling and Composting Ordinance, which was revolutionary in being the first composting law, requiring all citizens to separate their waste into 3 categories: recycling, trash, and compost. By 2018, San Francisco reached a diversion rate of 80%. 2 industrial composting plants handle the majority of San Francisco's food waste and run the best composting program in the United States. The plants handle 650 tons of organic waste a day, diverting a majority of waste from landfills, reducing greenhouse gas emissions, and profiting from making large amounts of fertile soil. Culturally, San Francisco and Philadelphia view waste reduction very similarly, first looking to the consumer. Because San Francisco only works with one private company for waste management, there's less friction, but this is not the case with Philadelphia. San Francisco's biggest success is their comprehensive food waste system. While Philadelphia is currently looking for a similar solution, there's no citywide compost system that residents can use, only various private options and pilot programs. In 2018, Vancouver became the first city in the world to approve a comprehensive strategic zero waste plan, one that's target is ambitiously completely zero waste rather than reducing to a certain percentage by a certain date. Since the plan's approval less than 2 years ago, it has evolved and improved to place focus on tangible actions with reasonable deadlines and modes of implementation including increasing food and material diversion, reducing single-use plastic items, and enforcing litter management and education strategies. In May of 2018, Vancouver opened a brand new $2 million waste facility. It's special because it accepts many more materials than traditional recycling and compost centers, including the city's own previous center. In reviewing its zero waste plan, community outreach is a priority to Vancouver, and a large part of their program is providing resources and support to buildings, businesses, and schools. Philadelphia has similar plans to educate the city as a large part of its own zero waste goal. Documentation of waste consumption is incredibly important and almost necessary to improve over time. Vancouver has been documenting its waste since at least the late 1960s, while Philadelphia only acquired the computer to calculate these reports last year. In 2014, Vancouver passed the Green Demolition Bylaw that requires a permit for demolition and the majority of materials to be recycled. Philadelphia has a similar law requiring registration of contractors and waste haulers before demolition. Among each of the cities we looked at, there are commonalities that each have identified as being important or necessary in order to reach zero waste. These include collection, financial incentives, food waste management, diversion, community outreach, and a comprehensive plan. After implementing or expanding upon these goals, Philadelphia will be well on its way to a zero waste future.
Okay, thank you so much, Rachel. Next up, we have Marie. and her talk is called Convening Sustainable Learning, examining the community school framework as a mode of creating sustainable learning environments.
Great. Thank you, Jen. Good afternoon, everyone. Again, my name is Maria Masher-Batista. I'm a graduate student, and my research looks at sustainable design solutions for learning environments, specifically in cities. So I'm briefly going to discuss some issues that cause problems in schools, contribute to waste in communities, and can be harmful to people's health and well-being. So to begin, the problem my research considers really stems from the fact that the average American public school today, it ages to be about over 50 years old. They were built for the baby boomer generation when they were school-age children, and many have not seen major improvements to infrastructure since being built. So this leads to the majority of these buildings being in disrepair. And their layouts do not support more flexible, modern teaching methods. And all of these elements really can cause problems for students, communities, and the environment. So because so many of these buildings date back over 50 years, today we're seeing a lot of infrastructure issues. Every 4 years, the American Society of Civil Engineers publishes an infrastructure report card for different sectors in the United States. In 2017, the ASCE gave school infrastructure a grade of D+, which is not great, but was up from a D in 2013. Their report states that 53% of public schools need improvements to reach what they would deem good condition. So not even great, just good. Improvements to infrastructure not only take time and cost money, but create waste materials that often head to landfills and create localized noise and air pollution during demolition and construction processes. So one of the problems of these outdated buildings is old HVAC or heating and cooling systems. Schools with these outdated systems have been found to contribute to increased risk of asthma for students, as well as sick building syndrome, which can cause headaches and fatigue. They also waste energy, pulling on electricity supplies while really not functioning at optimal levels. Another infrastructure issue deals with the lack of windows. So many schools designed around the 70s were designed with minimal to no windows because it was thought that students would be too distracted if they could look outside. Yes, thank you to whoever laughed, I agree. Schools designed without windows do not provide access to daylight or view, or create opportunities for natural ventilation, which is bringing fresh air from the outside in. These conditions require more energy use from artificial lighting, as well as mechanical HVAC systems, usually those outdated ones that don't work great, that need to be run for the temperature control of the building. So access to daylight and fresh air are additionally two qualities that have been found to contribute to student performance and success, as well as teacher retention. Finally, these old buildings often contain materials in their built environments that have been found harmful. And as an interior designer, this is something I think about a lot. Materials such as asbestos and lead-based paints were commonly used, and when damaged over time, can lead to potentially serious health implications. Our own campus paper, actually the Triangle, just published a headline paper this week that talks about the issue of asbestos in Philadelphia schools, very timely for my talk today. And unfortunately, that's not a problem that's unique to Philadelphia. And lead paint that is removed from schools adds to toxic waste that's generally then dumped in hazardous waste landfills. So, the U.S. Department of Education expects school enrollment to rise to 60 million students by 2030 in the next 10 years. And the current dilapidated state of these built environments for public education cannot properly support the needs of these students. And if they can't support students, then they can't function in ways that support communities as well. So my research has developed to focus on community schools, the NEA definition of which you see up here, but really you can think of a community school like a smartphone. The way a smartphone integrates a ton of features into one device, a community school integrates education and services into one built environment. So as a researcher and interior designer focused on sustainable solutions, I really view community schools as inherently sustainable spaces. All of these activities really happening in one place, and with the proper planning and design, they can be long-lasting spaces that serve communities across generations while doing minimal environmental harm. So, according to the United States Green Building Council, sustainable built environments should always aim to create spaces that are environmentally responsible, healthful, and equitable, while considering solutions that support the quality of life for all. This definition and sustainable design practices were not necessarily focal points when these schools were built 50 years ago, as evidenced by some of the facts I stated earlier. And today, however, sustainable design can contribute to the mission of community schools in order to be a hub for everyone in the community. So, some sustainable design initiatives that can address this waste and these issues. The first being easily accessible to all. So locating these spaces near public transportation in cities and providing opportunities to walking and bicycling where possible not only reduce the need for individual cars and then the pollution caused by them, but also encourage more active lifestyles among people. Secondly, community schools are often open outside of your typical school day hours. They may be open before and after school. They generally hold evening adult education classes, and on the weekends there's farmers markets and sporting events. So utilizing features like motion and daylight sensors can save on electricity consumption because lights are only on deliberately then when spaces are being used. And finally, as I mentioned, the selection of healthy materials is very important to me as an interior designer and can really have a big impact. People spend about 90% of their lives indoors, and if you think about being a young kid, you spend a lot of that time then in school. So selecting fabrics, wall coverings, paints, and other finishes that are not sending toxins into the air is the way to create a more sustainable environment and a healthier one for children and communities. Additionally, sourcing building materials locally cuts down on materials transportation, reducing carbon emissions. So when sustainable design choices and solutions like these are made, schools and their local communities can be best served and less harm is done to the environment. So to conclude, I'll leave you with 3 quick thoughts. The first being that public school infrastructure in the US is outdated and really crumbling. These dated buildings put a strain on resources such as energy and create waste when demolition and construction are needed. Second, these spaces and the materials used in them can be harmful to people and cannot provide benefits to larger local communities. And finally, I really believe that part of the solution to improving learning environments is to focus on sustainable design to help educate students, better serve communities, and can cause minimal harm to the environment. Thank you very much.
Awesome, thank you so much, Marie. Last up, we have Ashley Richardson, and she is going to be giving a talk today titled 6 Feet Under, Rethinking Death and Waste.
All right, so there's no easy way to introduce my topic, but to put it bluntly, I will be talking about death and alternative burials, which is kind of a tough topic for a lot of people to talk about, but oftentimes many people think that when we die, like, we don't produce any more harmful waste, but this isn't the case. So I actually worked on this with a group, but my group and I looked into ways to minimize this waste through alternative burials. So as we look at the current and most followed funerary practices, we can see how large their carbon footprints really are. Many people believe that urns and cremation are the better option in comparisons to like burials, caskets, and embalming, but both practices are actually quite harmful. Urn and cremation practices create about 414 kilograms of CO2 emissions when you look at like the fuel being used, manufacturing of the urn, and then the travel it costs for scattering of the ashes. And then there are many chemicals that are emitted from our bodies when we are actually cremated, and then some of these chemicals are actually seeped through the filtration system and enter the atmosphere. And then on the flip side, when we look at casket and embalming practices, it is almost double in comparison due to carbon emissions due to the materials being used for the caskets and travel for the body. Embalming fluids are also pumped into a person's body, and they contain many harmful chemicals that have been linked to brain and colon cancers, as well as leukemia. Also, the common materials made from, for the casket are commonly made from non-biodegradable materials, which make it very hard for it to decompose in the earth when it is buried in the ground. And these harmful funerary practices are not only practiced in the US, but worldwide. So thinking more globally, when we talk about burials, we have to think worldwide. Looking to old and new traditions around the world, we gain a better view of what people value and the sensitivities to what we address in creating these new burial methods. Common threads through different burial rituals and rules around death are a sense of uniqueness and personalization, because if you think about it, in the US, there's like different tombstones for everybody, and in Ghana, they really go all out in personalizing coffins, and then there's also a physical and actionable remembrance so that death can live on as like this continuation of afterlife in many practices. So in the past few years, there's been an increased interest in what you can call green or eco burials. Typically, these burials are in like a natural setting, so there's no embalming, no gravestones, and the body is covered in a cotton shroud and placed in a wicker coffin or no coffin at all. However, the CDC has reported that the human body contains 216 toxic pollutants, which are stored and then leached into the soil and harm the environment when we are buried. So in reaction to that, designer Raim Lee was studying recycling systems at MIT when she visited a green cemetery, and then that kind of sparked her research in reimagining our relationship with death. So she created this infinity burial suit, which is a garment that you put around the deceased and is designed to be completely biodegradable and zero waste. It has a built-in biomix embedded in the suit lining designed specifically to aid in decomposition, work to neutralize toxins in the body, and then transfer these nutrients to new life. It does this through mushrooms and the process of mycoremediation, and where the fungi returns the pollutants back into the soil through a less contaminated state, making them more bioavailable to other organisms. Another alternative burial that we researched was the biodegradable urn, developed in 1997 by brothers Gerard and Roger Molay, who are hoping to find a way to give the deceased some form of new life. As people become more eco-conscious, cremation along with biodegradable urns are becoming more popular, because they break down into the environment without leaving a carbon footprint. They're made from many different organic compostable materials, such as recycled paper, leaves, coconut shells, but in the end, there are no toxins, so there's no chemicals, no adhesives, and no dyes going into the manufacturing of these urns. And there are actually 4 different types of urns. There's the burial urn, which is the most popular, and it doesn't biodegrade until it touches the soil. There's the tree urn, which is displayed in this picture up on the screen, that allows you to turn your loved one into a memorial tree. There's a water urn, where it biodegrades into water and ocean. So if you want like a sea burial, if you will, you can do a water urn. And lastly, there's a scattering urn made to scatter your loved one's ashes. And lastly, we looked at the biodegradable biopolymer egg. This final alternative burial was created by Raul Drexel and Anna Santelli, who wanted to create this idea of completing the circle of life after we die. The biopolymer is extracted from plants and made into this plastic-like material that breaks down not only the body and ashes, as well as the shell, to provide nutrients to tree or other plant life. Currently, they are still working on a model for burying the person, but they have completed the model to essentially kind of like an urn, but in an egg form. The designers also haven't had much success in launching this current product, as eco-burials are currently illegal in Italy, which is where they're from, and in the United States, there's only a registered 93 green burial sites due to laws and regulations. However, with this idea, we can turn these big plots of cemeteries into thriving forests. We are trying to bridge this gap between living and the dead using burial spaces as public parks and spaces for life, just like if anybody knows, the restoration of Laurel Hill's garden in Philadelphia. So the alternative burials that we looked at, the biodegradable urn and the egg, still have a huge fuel cost due to the cremation processes emitting CO2, but they try to make up through that through the materials and transportation. The best option we found was the infinity burial suit, because it omits cremation altogether. However, although it seems like it's the best option on paper, it might not be the best option for everyone or every culture, because the idea of being eaten alive by mushrooms could kind of rub people the wrong way. And lastly, so the current design challenge we face today is creating the most sustainable burial solution that integrates current practices and rituals, but also develops the play to similar worlds and how we cope with death. It's a tough topic to talk about, but if we keep denying death, we eventually, we continually deny the living. Thank you.
All right, thank you so much for all of your talks. I'd like to just take a minute and think about some common threads between all of these panelists today. What I really enjoyed about hearing all these papers together is thinking about these concrete practices of system level change. Because so often when we think about sustainability and we think about green issues, it's framed at the level of the individual, or it's one more burden being placed on the consumer, one more responsibility placed on the consumer. And what I love about being in attendance at this conference today is that we've had a lot of discussion about system level change, because for a problem that is this big at such a large scale, we have to talk about solutions that scale. So I really enjoyed, thinking about these practices, concrete practices of system level change. So, from Tim's talk about getting a sustainability office off the ground at Drexel, that's something that could be and needs to be implemented university-wide. So that's also like a great policy development right there, is what would that look like at every single university and college in America if it was required to have a sustainability office. And then we go to there to considering how zero waste is being developed and implemented in cities around the world, in Rachel's work. And then we're thinking about Marie's work and retrofitting and redesigning schools. And then we're, thinking about the redesign and, redesigning the carbon footprint of burials, and then, also thinking about artistic interventions, using trash to think about our cultural carbon footprint. So that was some interesting, things I noticed between all of these talks. So now I'd like to open it up to the audience for some questions for everybody. Questions or comments? Feel free to make a comment. Yeah?
I have a question for Tim regarding, so if I understood correctly, you went to the university about sustainability, and what was their response back? I mean, are they trying to say that there's already things in place, and what is their, what did they say were in place already and not needed?
Sure. So our initial conversation was about a year and a half ago with them. They eventually did put in the budget proposal for this fiscal year a position for a sustainable administrator, but due to various constraints, that position was ultimately denied. So I do have a presentation this coming Monday with President Fry and his group to again reinitiate these conversations. And so this time we have much more information on what is happening, why we need this. We've been working with a lot of student groups in the past few years, and they all think it's something that's very vital for their work. So we're hoping that by showing that there is a large need and desire for such a position, that will be better able to persuade the university.
The idea of community schools is really fascinating to me, and I was wondering if you found any great examples, as you're doing research, things like that.
Yes, thank you for your question. I have been doing a ton of research on community schools over the past year and a half now at this point, and I've been very lucky to connect with South Philly High School, which is a community school here. Philly is sort of growing its network of community schools right now. It sort of adds a couple in every year or fiscal year. And there's really great examples in other cities. Baltimore as a city does a lot of work with community schools. California, you can find some really beautiful examples of really schools becoming hubs and community centers and places that people can go to get a quick health evaluation, get some free produce on the weekend, And there's also great precedent in Scandinavia. They kind of think of education as for everyone. So while that's very hard to do here, we're a very different scale, it does happen sort of in smaller pockets. Does that answer your question? Okay, cool. Yeah, thanks.
So I want to jump on that question about schools. Thinking about public schools, especially here in Philadelphia, versus maybe public schools in places like Lower Merion, there seems to be a huge disconnect in terms of opportunity. And so did you give any thought in terms of creating community schools where perhaps the community isn't as prosperous or as well off, and therefore having less of an opportunity?
Sure, yeah, thank you. That's kind of, so between my two thesis projects, a lot of this is my research side. The other side, the interior design thesis, is actually very much focusing on sort of the speculative design of a community school for a community where resources are scarce. And I think that's where community schools really can find a foothold, because they do offer things that are hard to access, services that might not be in that immediate neighborhood, which is kind of why I stress transportation, because to be a community hub, you do need to be there and accessible. And then the other thing people always bring up to me when I have these conversations is about funding, and the funding structure towards just schools in general here is inadequate. And we do know that funding is very much determined by zip code, so somewhere like Lower Merion is going to get a lot more funding for extracurricular activities, et cetera, where South Philly High School just recently got sort of a $500 donation for an alumni, and they were really able to stretch that far because they had to. And I think that's a strength of kind of the people who are invested in and running these community school spaces. Yeah, thank you.
While we wait for comments and questions to trickle in, actually, Juliana and Rachel, I'd like to ask you about what didn't we get into the presentation today? If you could, give us really quick another point that you wanted to make that you in the 7-minute timeline you had to cut.
Thank you. So kind. It was just more so it was a group project. There was 5 of us that we actually had to make a 30-minute presentation. I had to squeeze it into 7 minutes. So I was freaking out. I wouldn't make 7 minutes, and then I hit it right on the buzzer, so that was exciting. But anyway, I was just going to divulge into more about the history behind each alternative burial, because there's so much that goes into it that we don't really think about, because again, nobody talks about it. And our group learned so much about burials and death that we didn't know before, but probably mostly just the history that goes behind all the alternative burials. And there's a few more that we didn't research. I forget that, like aquamization, like medation or something like that. That was another form of, there's just so many alternative burials that we didn't realize. We thought there was like these 2 options that we would have probably branched into if I had a little more time.
And was this for a class project or?
Mine was for a class project, yes.
I guess for me, I also had a lot of just research and information that, of course, you have to just kind of pare down, and I chose to focus more on the role that Rare plays in the community, especially with just, implementing art initiatives and pairing that with how that kind of works with individuals. However, I did find a lot of kind of research and a lot of kind of just great thoughts from Gay Hawkins in The Ethics of Waste, just a book that I heavily relied on the research. And if I had more time, I probably would have included a lot more of her theories about waste, specifically how she calls trashing a cultural performance, and how the way we throw away trash is just as important as trash that we produce, and just kind of exploring that area. And then just more so, I guess, probably just more about recycled artists and residency programs, and finding similarities between ones across the nation worldwide, specifically maybe looking at the intersections between ecology and Rare in Philadelphia.
So I was in the same position as Ashley. I had to pare down a presentation that was originally around 30 minutes long, but I think I touched mainly on everything. The main specifics that I had to skip over, unfortunately, were some of the more specific kind kind of goals in the immediate future rather than just the overview of what each of these cities kind of had going for them. So specifically, I would have talked about like the implementation of like the single-use plastic laws in like Vancouver versus Philadelphia, or dive further into the demolition laws and how that they've kind of regulated building demolition in different cities. So yeah, just more specifics.
And is there anything that you guys would like to ask each other as panelists?
I think you guys did a great job.
Okay, open back to the minutes.
I have a question for Ash.
It's Ashley.
Like you laid out a whole bunch of really cool solutions for the whole problem that so much land is considered like the traditional trees on a river. But one of the barriers to that is the fact that it's kind of like expensive to die.
Yeah.
So, like, how would you address? Would you have anything of how you address that barrier?
Like the cost of it?
Yeah.
I know, how much was the mushroom suit? $1,500. Yeah, so they're like trying to also pare down that cost with the alternative burials because it is extremely expensive, and it blows my mind honestly how a person dies and the people that are living have to deal with like all the costs that come with it. And so I know the mushroom suit, and I forget how much the egg was, but I also believe it was less than what a urn or a casket would cost.
If the Office of Sustainability is approved, what do you see as like the first major project or thing in Drexel you want to tackle?
So I think a very important step in tackling what the university needs to do is doing an entire inventory of what's going on. So my committee has already started working on initial steps for this, but as students we are limited in resources that we have. So having this office with the resources that they have, look at everything that's going on, look at what student groups are doing, faculty, staff, what the infrastructure is like, what the practices are at the university, to get an understanding of what things are efficient and what things aren't efficient, so we can amplify the things that are working and kind of work to remodel the things that aren't quite working. Thank you.
I just find the death thing really interesting. So do you think that people's, I guess I want to say like their comfort being around a dead body maybe will have to change over the years, where they'll have to become, or like us as a culture will have to become more comfortable seeing and being around the dead body, because with those generations, you can obviously tell those are like bodies, like the suit, the egg not so much, but I think the original one too was also, you could tell it was a person.
Yeah.
So seeing an actual body in the ground is a little different compared to seeing like the box going in.
Yeah.
Like, none of it's easy, but I think, like, do you think it'll have to be a cultural change for everyone to be more comfortable with death as a whole for this to catch on?
Oh, for sure. And that's like one of the things we try to touch on is that like nobody talks about it. And it would be easier. They do ways, like I believe like it would be hard to see like the actual body with the suit on it, hard in the ground. But even like with cremation, it's a little easier because you just see the urn. But the idea is that we just have to change our outlook for sure in our culture, that like death is such like a not frowned upon, but everybody does it, but it's such a sad, and I definitely think that idea has to change in order for like this problem that not a lot of people know that it's a problem. Like I had no idea that I thought when we die, like there's no ways we release, but for sure that the culture around it needs to change.
And what are some ways that you think that the culture could become more comfortable seeing dead bodies and being more comfortable with like this thing that is real?
That's a good question. I don't know. I think just like having open discussions about it, not being such a quiet thing that like nobody talks about. Like being open to discussion, I think is just, I'm not sure how to initiate that discussion. Again, I didn't even know how to open up my presentation because you guys all had wonderful stuff about waste, and I was like, I'm just going to talk about that and see how it goes. But definitely for for sure. I think just more open discussion, like maybe individual research, just to like think about it more. But yeah, it's definitely something that it's a process.
More questions? All right, again, back there.
Rachel, I have one question for you. Of all the case studies that you did, what's the one thing that you think Philadelphia could take away from the case studies that they could apply?
I think out of the 4 cities that I looked at, San Francisco and Vancouver were some of the more tangible like actions that we could really like take hints from. I think San Francisco is doing really cool things with composting and specifically like their ecology, having a private company with waste management for that. It's allowed them to do some things that maybe like with several public companies or just smaller like things like we wouldn't necessarily be able to do that. So I mean, yeah, San Francisco has kind of for the longest amount of time been like doing things from the very beginning, and then Vancouver, they just started, but they're making very rapid progress. So I think both of those are really tangible.
And there's also a cultural, component there. Is that
Right.
the West Coast